Hello, my name is Sean Harris. Today we'll be going over coding for spinal procedures. This section is one of the most difficult sections for a lot of coders, but I'm going to simplify this information as much as possible for you guys to get a good understanding of how to code for this section correctly. Keynotes for this section. When coding for this section, bone grafts are reported separately in addition to arthrodesis. To report bone grafts, you will need to see codes 20930 to 20938. Do not use modifier 62 with these codes. Instrumentation is reported separately. You will need to see codes 22840 to 22855, codes 22840 to 22848, and 22850 to 22852. You will not add a modifier 62 to those codes, okay? No 62. When an arthrodesis is performed in conjunction with other procedures, a modifier 51 will be added to the arthrodesis code. Okay, for example, if a fracture repair is done and an arthrodesis is done with that fracture repair, you would code the fracture repair and the arthrodesis with the modifier 51. I wanted to explain modifier 62 a little further. This modifier is to be used when two surgeons work together as primary surgeons to perform a distinct part of a surgical procedure. Okay? If an additional procedure, including add-on procedures, are performed during the same surgical session, separate codes may be reported by each co-surgeon with that modifier 62 appended. Okay? Each surgeon should report his or her distinct operative work. So that's when that modifier 62 can be used. Except for the codes that I mentioned before that the 62 cannot be added to. Okay? Okay, so let's start with the incision section in your spinal section. So you would look at 22010, which is where it starts. It reads incision and drainage. It's open of a deep abscess. Okay? Subfascial. Posterior spine. The location for this particular code is cervical, thoracic, or cervicothoracic. Alright? Then under it you see codes 22015. This is to be used for incision and drainage. Again, this is an open procedure of deep abscess, posterior spine, lumbar, sacral, or lumbar sacral. You are given information within parenthetical notes that you should never skip. Okay, you're told do not report 22015 in conjunction with 22010. You're also told do not report 22015 in conjunction with instrumentation removal, which are codes 10180, 22850, and 22852. And if you want to code for the superficial layer, you will need to see codes 10060 and 10140. These codes are found in the integumentary section. Okay, now let's talk about excision codes. When coding for codes 22100 to 22116, modifier 62 is allowed with these codes. Codes 22100 to 22102, 22110 to 22114, and add-on codes 22103 to 22116, as long as both surgeons continue to work together as primary surgeons and perform distinct parts of this particular procedures. These procedures is what I'm trying to say. Okay. There's also some notes here, parenthetical notes for bone biopsy. You will need to see codes 20220 to 20251. You would need to report soft tissue biopsy of back or flank with codes 21920 to 21925. For needle biopsy of soft tissue, you're going to need to use code 20206 to report excision of soft tissue tumor of the back or flank. You will need to use code 21930. Then you get further into the codes themselves, which are 22100 again to 22116. Code 22100 are for to be used for partial excision of posterior vertebral component. Then it gives an example of the different components that you can use in this particular code for. Again, this is partial excision. If you're going to code for the total excision, you will need to go to the other section, which are codes 63081 to 63091. But these are for partial excision codes. So for partial excision of posterior vertebral component, this is what you will code 22100. And that will be used for the cervical area. And this is for a single vertebral segment. Okay, again, single means one. If you want to code for more than one, you will have to code for each additional by using code 22103 for each additional segment. 22100, again, that's for the cervical area. 22101 is for partial excision of posterior component for the thoracic area. 22102 is for the lumbar area. Okay, so make sure you're paying attention to that. Under 22103, it tells you that you can use this code with code 22100, 22101, and 22102. Again, 22103 will be used with those codes. Code 22110 is for partial excision of vertebral body for intrinsic bony lesion without decompression of spinal cord or nerve root. This is a single vertebral segment as well, and this particular code is a cervical. I do want you guys to pay attention to the differences between 22110 and 22100. 22110 is for the vertebral body, which is a different location from the other component. Okay? It's not the same location. That's the difference. 22112 is partial excision of vertebral body for intrinsic bony lesion without decompression of spinal cord or nerve roots, single vertebral segment thoracic. And then 22114 is for the lumbar vertebra. Then you have 22116 for each additional. And then it'll tell you in parenthetical notes. You're going to use 22116 with 22110, 22112, 22114. And then you're going to read all the notes again in the parenthetical notes located in the chapter, which I've done with you so far, just to get you guys into the habit of reading these parenthetical notes, because for whatever reason, people skip them. So make sure you read them the way that I did. I'm not going to go over every single parenthetical note because there's quite a few. But make sure you go over them before coding for this section. Okay, do not skip these notes. Okay, let's talk about coding for osteotomies. You're going to use codes 22590 to 22632 when orthodesis are performed with these codes. Okay, a modifier 51 may be needed. You're going to report codes 22840 to 22855 for instrumentation when used during these procedures, the osteotomy procedures. Do not use modifier 62 with codes 22840 to 22855 as mentioned before. Refer back to your notes, okay, because it specifically tells you which codes to not use modifier 62 with. Report bone grafts when used with osteotomies, which are codes 20930 to 20938 Do not use Modifier 62 with these codes. According to your CPT book, spinal osteotomy procedure codes are reported when a portion of the vertebral segments is cut and removed in preparation for realigning the spine as part of a spinal deformity correction. For excision of intrinsic lesions, you guys will need to refer back to your previous section, which are codes 22100 to 22116. For decompression of the spinal cord, you will need to see codes 63001 to 63308. For these particular codes, you may use Modifier 62 as needed for codes 22210 to 22214 and 22220 to 22224, and associated add-on codes 22216 and 2226. Okay? And again, you will use the Modifier 62 when two surgeons work together as a primary surgeon performing distinct parts of a procedure. Okay? Okay, for the following section in the osteotomy, for these codes in this section, I'm going to go over the parts of the vertebra again, just as a reminder, okay? Again, there are 3 different parts that you guys are going to need to be concerned about when coding for osteotomies. You have 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, okay? Within each of those vertebrae, you will find that there's a vertebral body, a pedicle, articular facet, lamina, and there's a spinous process within each one of the vertebrae. Okay? Each one contains that. And I'll explain further in a second. Now remember from the previous slide, we mentioned that each vertebrae is further divided into the vertebral body, the pedicle, the articular facets, the lamina, and the spinous process. Okay? The CPT book took those parts and then placed them within 3 columns. The first column is the anterior column. It's the anterior 2/3 of the vertebral body. Then you have the middle column, which is the posterior third of the vertebral body and the pedicle. And then the third column is the posterior column, which consists of the articular facets, the lamina, and the spinous process. Okay, so now let's discuss the different approaches the physician will take when performing the surgery. Okay, if a patient is placed in a lateral position, the patient is laying in a way that the physician can operate on the patient's side. An anterior position means the patient is laying in a way that the physician can access the chest or the front of the patient. Posterior refers to when the physician has laid the patient face down and is accessing the operative site by going through the back. Okay, so now let's get into the specifics of the actual codes. Codes 22206 to 22208 are 3-column osteotomies. Now, if you go back to what we talked about before and actually look at the code descriptions, you'll understand what I'm referring to when I say the 3 different columns. When we're talking about the anterior column, we're talking about the middle column, and we're talking about the posterior column, all being done in the patient at that one time, that one surgical session. The reason why this code was created, was because they needed a code to specify when the physician is performing a complex procedure that requires for all three columns to be worked on at the same time. A condition that would require this would be if a patient was suffering from scoliosis or some type of severe spinal deformity. The other codes, 2210 to 2226, are one-column osteotomies. They're only performed on one column, okay? So take note of the differences. You also need to pay attention to the fact that codes 22206 to 22216, these procedures are performed using posterior or lateral approaches, okay? Codes 22216 to 22226 are all anterior approaches, and they include discectomies when performed, okay? Highlight that information within your codes so you don't forget that, okay? You're also going to need to make sure that you're paying attention to the fact that code 22206 is being performed in the thoracic area. Code 22207 is performed in the lumbar area. Code 22208 is for each additional segment, okay? Each additional one. Code 22210 is for the cervical area. 22212 is thoracic. 22214 is lumbar. 22216 is each additional vertebral segment, okay? And that's for codes 22210 to 22214, okay? Remember, when you're coding for the add-on codes, pay attention to the parenthetical notes listed under it because it will specify which codes this add-on code can be added to. And I'm just going to go backwards for a second and go to 22208, and it tells you that you would use this code along with 22206 and 22207. Okay? Again, pay attention to the add-on codes. Code 22220 is being performed in the cervical area. 22222 is thoracic. 22224 lumbar, and 22226 is each additional, and that code is to be used with codes 22220, 22222 through 22224. And there are additional parenthetical notes that I do not want you guys to forget within this section of codes under 22208. You'll see that you're not to report 22206, 22207, and 22208 in conjunction with 22210 to 22226, 222830, 63001, 63048, 63055 to 63066, 63075, 63091, 63101 to 63103 when performed at the same level. Okay. I want you guys to take note with that last comment I made in reference to the levels. When I'm referring to the levels of the spine, we're talking about the neurological part of your CPT book and not the musculoskeletal. We'll get further into the neurological part of the spine once we get into that section. Okay, so we're going to come back to this. Okay, so now let's talk about fractures and or dislocations. Within this section, just like the previous section, you will need to add additional codes as needed. If you need to code for arthrodesis, you will see codes 22590 to 22632, and you will need to append that Modifier 51 as needed. If you need to report for instrumentation procedures, You will see codes 22840 to 22855. You will also need to make sure if you need to code for the actual bone graft, you will need to go to codes 20930 to 20938. For the following codes, when two surgeons work together as primary surgeons performing distinct parts of an open fracture and or dislocation procedure, each surgeon should report his or her distinct operative work by appending Modifier 62 to the procedure code in the situation where Modifier 62 is needed for procedures 22318 to 22327 and as appropriate to use the associated additional codes, add-on codes 22328, as long as both surgeons continue to work together as primary surgeons. Okay? And all that information came right out of your CPT book and your guidelines. Now, I do want to remind you guys to make sure you don't use Modifier 62 with some of the codes that I named from before, like the codes for the instrumentation procedures. You're not going to use Modifier 62 with some of those, as well as the bone grafts. Don't forget that. I may not mention it every time, but I want you guys to always refer back to your notes and reference to those particular codes that we talked about previously. Okay, and again, you'll see all of that information within your guidelines. All right, now let's talk specifically about the codes within this section. Codes 22305 to 22315 are closed treatments. 22305 is closed treatment of vertebral process fracture. That's all it is. It's treatment. Then you have code 22310. This code is described as closed treatment of vertebral body fracture without manipulation, requiring and including casting or bracing. Then you have codes 22315, closed treatment of vertebral fracture and or dislocation, requiring casting or bracing, with and including casting and or bracing by manipulation or traction. Now, I have on my slides just the specifics of the differences between the code descriptions. You guys can highlight that information, so when you look at the code right away, you'll see the differences within those codes, okay? Number 1, 22305 is for the vertebral process. 22310 is for the vertebral body, and it does not include manipulation. And when we're talking about manipulation, we're referring to realigning the fracture into the way it's supposed to be aligned in the first place, the original alignment of that bone, okay? That's where you're reducing it. You're putting it back into place. Sometimes in procedural notes, you'll see the word reduction. Sometimes you'll see manipulation. They're one of the same. Codes 22315. It includes the vertebral fracture, of course, but it also includes a dislocation treatment. So if a dislocation is being treated instead of the fracture, you can use this code, and it says and also. So it can be a fracture and dislocation being treated at the same time. You would use this code. In other cases, if a fracture is being treated at the same location as a dislocation and there's different codes involved, you would code for the fracture only. That's just the FYI situation. And this particular code includes the casting or bracing, and it also includes, again, the manipulation or traction. Okay, so now let's discuss the open fractures in this section. Codes 22318 to 22328 are all open treatments. Codes 22318 to 22319. This involves the odontoid fractures and or dislocations. Okay, anterior approach for both of those codes. The main differences between 22318 and 22319 is that 22318 is without grafting, whereas 22319 includes grafting. Okay. Codes 22325 to 22328. They are open treatments and reductions of vertebral fractures and or dislocations, posterior approach, one fracture vertebrae, or dislocated segment. And then it specifies for 22325 that this is of the lumbar region. Code 22326 is for the cervical region. Code 22327 is for the thoracic region, and then you would code for each additional fracture vertebra or dislocation segment by using 22328 in addition to the codes 22325 to 22327. Again, guys, do not forget to read all of these parenthetical notes that are listed here. Okay, so for reporting manipulation, you will use just code 22505, and that is reported for manipulation of spine when requiring anesthesia. And it's for any of the any region, cervical, thoracic, or lumbar. It's not specific to the region. If you need to report this particular procedure, manipulation, without anesthesia, you will need code 97140. Percutaneous vertebroplasty and augmentation. Okay, so when coding for this section, you guys are going to need to use codes 22510 to 22512 for reporting percutaneous vertebroplasty. When coding for percutaneous vertebroplasty, it is defined by the CPT book that this is the process of injecting a material, such as semen, into the vertebral body to reinforce the structure of the body using image guidance. Okay, so that is your vertebroplasty. Now your augmentation codes are 22513 to 22515. Okay, and according to your CPT book, this is the process of cavity creation followed by the injection of the material such as semen under image guidance. That's what that is for. When reporting these codes, make sure you guys are paying attention to the fact that these codes are pertaining to the actual body area. Okay, so if you look at code 22510, this procedure is being performed on the cervical thoracic area, whereas 22511 is the lumbar sacral area. You will also find that 22512 is an add-on code. This is used in addition to 22510 to 22511 to report for each additional cervical, thoracic, or lumbar sacral vertebral body. Then when coding for the percutaneous augmentation, you need to make sure you also realize that these particular codes are also based on the location or the region. 22513 is the thoracic region. 22514 is the lumbar region. 22515 is going to be reported in addition to those codes to report for each additional thoracic or lumbar vertebral body. There are parenthetical notes that you guys will need to review within this section, okay, because you guys are going to remember to look at those at all times to make sure you're reporting your codes correctly. I'm not going to go over all of those at the moment because I want you guys to get in the habit again of reading that information. It's going to be very important for your coding, okay, guys? Arthrodesis, which is sometimes referred to as spinal fusions, may be coded with other procedures such as osteotomies and fracture repairs. You will need to append Modifier 51 as needed. Arthrodesis codes 22585, 22614, and 22632 are all add-on codes, and you do not need to add a Modifier 51 to those codes. Code 22830 is used for exploration of fusion. You will need to use Modifier 51 when coding for this particular code in addition to other procedures being performed. Code 22830 is not always coded along with other procedures because sometimes it's included in other procedures. So be careful when coding this 22830. Now let's discuss what's included in this section and what you need to pay attention to. In this section, you need to pay attention to the approach, whether this procedure is being performed via anterior approach, posterior approach, and so forth. That's going to be important. You're going to also pay attention to the location of the procedure. Is this procedure being performed in the thoracic area, the lumbar region, or the cervical region? You're going to read each description to see what is included in each code, for the simple fact that some of these codes will include discectomies, infusions, and other procedures. You will need to code additional codes for the instrumentation and bone grafts. Please do not forget to use the guidelines for reporting the instrumentation of bone grafts along with the Modifier 62, which we've discussed a couple times over. Make sure you remember those rules when reporting additional codes for the instrumentation of bone grafts, okay? Okay, so now we're going to go into the specifics for coding lateral extracavitary approach technique. Codes 22532 to 22534. This section will require that the surgeon complete a resection of the ribs and dissecting of spinal paraspinal tissue to gain access to the actual vertebral body and disc in this section. Make sure you're paying attention, just like with all the other sections within the orthodesis section in the book. To pay attention to the location, 22532 is referring to the thoracic area, 22533 is referring to the lumbar area, and 22534 is referring to the thoracic or lumbar, each additional vertebral segment. So when you're coding for the 22534, you're going to use that code in addition to the 22532 and the 22533. The anterior and anterior lateral approach technique codes 22554 to 22558. 22554 to 22558 are for a single interspace. Code 2285 is for each additional interspace in conjunction with 22554 to 22558. Modifier 62 is allowed with these codes, and you may use Modifier 62 as needed. Vertebral segment and vertebral interspace. A vertebral segment describes the basic constituent part into which the spine may be divided. It represents a single, complete vertebral bone with its associated articular process and laminae. Vertebral interspace is the non-bony compartment between the two adjacent vertebral bodies, which contains the intervertebral disc and includes the nucleus pulposus, the annulus fibrosus, and two cartilaginous endplates. Instrumentation. Non-segmental instrumentation is defined as fixation at each end of the construct and may span several vertebral segments without attachment to intervening segments. So if you look at code 22840, you will see a picture right under it of what a non-segmental instrumentation looks like. Segmental instrumentation is defined as fixation of each end of construct, which is known as a rod, with at least one additional interposed bony attachment. You can look at code 22842 to 22844 in your CPT book in the AMA Professional Edition to see a picture of what that looks like as well. For spinal instrumentation, codes 22840 to 22848 and 22851 are add-on codes and will need to be added to primary procedures. Codes 22840 to 22848 are not to be reported with the reinsertion code 22849 and or removal of instrumentation code 22850. Code 22849 is coded for reinsertion when the hardware is being placed back in the same spinal levels as the previous placed hardware that was removed. Codes 22850, 22852, and 22855 are codes for removal of instrumentation and are to be reported when the removal of hardware is taken out without replacement. This concludes today's presentation. If you need to contact me, you can reach me at charris@learnmedicalcoding.com, or you can give me a call at 1-855-263-3669. Again, the number is 1-855-263-3669. To receive a list of all of our course offerings, you may want to go to our website, which is learnmedicalcoding.com. Thanks for joining me today. I hope to see you again.